Hi, my name's Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. Here with a special young lady who has an outfit much better than mine. So we actually were supposed to do this interview yesterday or tomorrow, and then we decided to do it today.
Because you like my outfit.
And it's just a spectacular outfit. Then you said you have platform shoes, right? Is that what those are called? And they match like the purple.
I'm an artist, if you can't tell. That's one of my many one of the many hobbies I like to do, and one of the things that ruined my neck.
Here, like Marion, a lot of people don't know this. Every day she makes me curcumin shots because, of course, it's yellow, so it must be a health food if it's yellow. So she puts like ginger and curcumin and ginger just has a lot of healing effects on the body, keeps the blood thin, and if you drink this, it's actually very, very strong. Why don't you introduce yourself, and then, what led you to Caring Medical? And you and I have known each other for a couple of years now.
Yeah, it's been almost 2 years, and my story is a long one. I hope I can get everything in, but I feel like details are really important because I hope I can help somebody else maybe not suffer the hell that I went through trying to go through the rigmarole, or whatever you call it, of going to doctor after doctor after doctor, to be let down time and time again. You didn't see me at my worst, so I wanted to say that. Yeah, so you saw me, and I was actually worried that you weren't going to accept me. And you know my chiropractor, Dr. Arena Lanza, and her husband Keenan, and they are excellent. They're in Bridgeville, PA, and so that's who I came to first because of your website. And I remember when I was having my really, really bad issues, it was May of 2022, where I was getting dizzy after I'd get home from work. And
what kind of work were you doing then?
I work at a golf course, and my job is it's fast paced, but I'm such an active person. I was a dancer before. If you go on my YouTube channel, I danced to Michael Jackson, or I used to. I was a really active person. Like, I worked at JCPenney's for years and years and years, so I was on my feet in platform shoes all day long. And so, yeah, I would work a full shift. I'd come home, which was an hour away from where I lived, so I did a lot of driving. I would dance when I got home if I wanted to. I was a really active person, and pretty much no health problems, except maybe a little bit of fatigue and maybe some heart palpitations that I would obviously attribute to maybe anxiety, or not really anxiety, but just stress of, having to be at work on time and not having that much time at home. And so I had a little bit of stress like everybody else, but nothing, maybe an occasional panic attack, nothing serious or whatever. In May of 2022 is whenever I started having some dizziness when I would get home from work, and I would put in 12-hour shifts, but my job was pretty easy. I take, instead of JCPenney's, when the pandemic happened, actually the fatigue that I had got better then, because we were all home for, COVID, and I have time off work. I don't know what to do with myself now, so my fatigue then improved. And, of course I was dancing, doing artwork and stuff, and I started working at the golf course. I worked 12 or 14-hour days, but I didn't have to stand on my feet all day like at my previous job. And so in May, when stuff started happening, that I was actually waiting on people and just serving hot dogs like my normal day, and all of a sudden my chest got so, like something was sitting on my chest. It was really tight, and I got so short of breath, that it was concerning, and I wasn't doing anything except giving people hot dogs. And so I actually went in the back room and I took off my necklaces, and my jaw was hurting a little bit and stuff. So then I was getting a little bit worried. I'm like, this is kind of like, am I having a heart attack? Like, what's going on? But it'll go away, So, well, guess what? Like 15 minutes later, it didn't go away. So I actually had to pull my friend, and I said, hey, can you come take over for me? Like, I'm going to go to the hospital. Like, I don't know what's going on, but it's not right. And a little bit nauseated too, Yeah. And so, like, I'd go to the emergency room and, told them, hey, like, I don't know if I'm having a heart attack or not, but I don't feel right, and they told me to take a seat. And this was while COVID was going on. I had never gotten COVID yet, so I wasn't thrilled about waiting there in the waiting room. If nothing was wrong, I didn't want to get COVID. And so I waited around for like 15 or 20 minutes, and they didn't take me. And I said, I'm going home. Like, this is ridiculous. So I went home, and the next day, it did seem to go away that day. And the next day, I just didn't feel so good. but not anything like that. And then the next day it came back in the evening after my day off that I had fun and I went to visit a friend, and in the evening I couldn't sleep because of that. And I went home that night and I was laying in bed and I said, Mom, it's happening again. And in that time, my right arm was doing stuff too, like it was like tingly or whatever. And so she said, well, I don't know what to do. Take your blood pressure. And I go downstairs because we have a machine, because my mom has high blood pressure, so does my dad. So I go to take my blood pressure. But before I even got the thing on my arm, I went into convulsions. And I got extremely nauseated to the point my mouth went dry. I almost threw up. And so I called 911. They kept me in the hospital all night. But they couldn't find anything except tachycardia, and which they said could be if you're worked up. I said, I'm not worked up. I said, I had a great day. I don't know what's going on. But that was the start of me just being told I had anxiety. But yeah, I was really upset about that because I knew something wasn't right. And then it was so that was in May of 2022, and it was only a couple months later, so it was August, and I started going to the wave pool, and it was like I wasn't putting the pieces of the puzzle together at the time. I had no clue it was coming from my neck at the time. What would you I just have anxiety, because I'm one of these weird ones that I didn't have any pain. I just had the neurological symptoms. And so whenever things started happening in August, though, that's when things really went downhill for me. So, and I didn't feel good from that point in May till August. I was having more headaches. I have a face twitch, a spasm that actually might start doing it now. Like, it does it periodically, a lot less now than it used to. However, that had gotten worse. The headaches and the face twitch and different things had gotten worse in those few months. By the time August came, my friend and I were laying out at the wave pool, and I had forgotten about this because it's something you don't even think about, but a kid was running backwards with his friends and tripped over my head. So I took a little jolt to the head at the wave pool, and I had my headaches, of course, that weekend were really bad. And I started to notice that I was shaky. Like, I couldn't, like I told you, my family screams, and if they're not screaming, something's wrong. But if they were, yelling loudly, discussing something, I would start to get shaky. And I noticed, like, what's going on here? Like, now I can't even listen to, and I noticed loud music was doing it too. Well, being a dancer, we go to bars, we go to concerts, look at me, loud music is so I noticed that it wasn't just the family arguing, because people again were saying, oh, your anxiety's getting worse. I'm like, but music relieves my anxiety, so
that's a clue.
Yeah, that's a clue that it's not really anxiety. I'm like, because the loud music is triggering it too. It's not just people fighting, and I couldn't yell anymore. It was just so strange, because I would start to shake, like if I yelled at my dad, which never happened before. Like, we yell a lot. And so anyway, it's just things that I knew that wasn't right. And then 2 weeks after the kid tripped over my head, I'm at the same wave pool, and I was with my friend Bill. You met Bill a couple times before. And so I got a little bit of competitiveness in me, because we used to dive in when the waves were going on, and the ladder was pretty much out of reach, and you wait for the wave to bring you up. Yeah, no big deal if you're a dancer and you're 34 years old, but I didn't think that was old, I guess. So I was like, it did cross my mind, you haven't been feeling so well, should you really do this, But of course, because he was with me, I got a little bit competitive, and I said, hey, can you do this? And so the wave brought me up, and I grabbed on, and the wave drops you down, so you are hanging with one arm on your whole body weight, and pulled myself up on that ladder. But after that, that's when things really went downhill for me. And I was like, oh my goodness, like, you shouldn't have done that. But what did that do to you? Like, how did pulling myself up, the same thing I did
What symptom were you having? Or you just were lightheaded all the time, or what?
After that
terrible fatigue, right?
Terrible fatigue. And it basically, from that point that I pulled myself up on that ladder, I could no longer dance after that, and I started having, so I don't know, like, I actually have been diagnosed with functional neurologic disorder and chronic fatigue, but fatigue never seemed to exactly fit. It was more of like an inability to do anything physical, because the day after I pulled myself up out of the wave pool, I tried to do a small dance for my TikTok video, and that's when I realized, like, I was only 30 seconds into some choreography, and I go inside to wait on a customer, and I had to hold myself up on the counter. I went into vertigo. I had acute nausea. I was very shaky from dancing. And then, so, like...
You don't know if your blood pressure or your pulse rate was
It was probably high when those episodes, I would assume that it was high.
Probably your blood pressure was low, and then your pulse rate was high.
First, they sent me to physical therapy because, of course, I'm like already like, why can't I dance? Because when I would try to dance, and not even like real hardcore stuff, you know, we're talking pretty simple movements I was doing. And I tried it again the next day because, of course, I tried to be positive. I tried to say, hey, like, I don't know what that was, but okay, enough dancing for today. We'll try it again tomorrow. So the next day I tried to dance again. Same thing happened. So now I'm starting to get a little...
When you say the same thing happened, the lightheadedness or the movement?
Dizzy. I would actually go into vertigo when I start after dancing from the movements, and I learned over...
When you said vertigo, like stuff spinning?
Well, stuff started to spin, and that would happen. I never had vertigo like constant like some people do. It would just be like, it would happen right before one of those attacks where I would convulse and have...
Try to show it. Like, what does it look like?
Like
when you say, like, you were conscious. You were conscious.
I was conscious.
When it was happening, but it was almost like you couldn't control your body.
I could not control it, no. It would just... And it actually... And what's weird is it actually felt like it was coming from my spine or from my neck.
You're definitely you're trembling and you can't control it.
Right. That was when I would have one of these acute episodes. But they sent me to physical therapy and said it was a pulled trapezius muscle, which I'm trying to figure out how you get nausea and dizziness and, you know, these kind of issues from a pulled muscle, which they did say the trap connects to the dura and you can have some dizziness if that tightens up. And, you know, so it sounded somewhat logical.
You did end up getting upper cervical chiropractic.
Yes.
So that helped like 25%, or how much did it help?
The upper cervical chiropractic came after the physical therapy because they sent me to PT. I get worse halfway through PT, obviously.
That usually means it's a ligament problem because they're trying to move you.
Right.
It's not a muscular problem, it's a ligament problem.
I knew something was wrong because halfway through PT, I was getting jerking of my... I mean, I'd go into PT...
Uncontrolled jerking.
Uncontrolled jerking, yes. And it would usually be half my body at a time. And it could be the right half, it could be the left. But it got to the point where I was so frustrated with doctors because I knew it was coming from my neck, because what triggered the really bad attacks, that's when I started going to the ER. I started going to the ER because obviously if half your body is jerking and twitching and you're so nauseated and you know something's wrong, but by the time you see the ER doctor, it's 2 hours later and you just have muscle spasms and anxiety. After going to the ER quite a few times, I had one of those attacks. And already I couldn't drive my car. I was too weak. It started to get to the point where this attack would happen just from me pushing on the brake to start my car, and the twitching and jerking, and my whole body would be in the spasm from pushing on the brake. And so I couldn't drive my car. I was basically housebound. And so I got on the phone and I said, what nerve controls? Because they were also telling me I had a pinched nerve, and my little knowledge of medical stuff when I was in school, I was like, if they're telling me that it's a pinched nerve, it has to be an autonomic nerve if there's such a thing. Because, you know, I was actually worried that there were lesions on my brainstem or something, because everything that I was having trouble with was autonomic functions. It was breathing, heart rate. So I literally just Googled that day, like, what nerve, you know, controls breathing, heart rate, digestion. And that's how I found your website. And it was the vagus nerve. And and I started learning about the vagus nerve and reading from your website and reading about the vagus nerve. Particularly one of your articles about the cardiovascular effects from the vagus nerve and all this stuff. It was like reading a story of my life.
Oh, great.
And so, yeah, that's how I ended up here ultimately. But first, you know, because I didn't think I could come to Florida, I talked to your nurses. Like, I called and I talked to the receptionist.
That's fine.
And I was just like, you know, I don't know if I can make it to Florida. So, like, but I also, my friend at the same time, now isn't this funny that my friend at the same time, and we're both Christian, we're actually Jehovah's Witness, me and my friends, and Jehovah God has helped me so much through all this. And I appreciate that you guys are, you know, Christians down here, and that's awesome, because I really do believe that God answers prayers. And this whole time I've been praying, you know, for him to lead me in the right direction, for what to do. And so, and my friend Gina was helping me research too. You met Gina. She was here on my very first treatment. She started getting neck pain too, and she'd gone to chiropractors her whole life, but she actually found a new one. And she's like, Mary, why don't you try this? Because she only deals with the upper cervical. And didn't you say you think you have upper cervical instability? And I said, yeah, from reading this website, that's what I think. So I said, but maybe these people can help me because they're closer to home and they deal with the upper cervical. So why not, you know? So yeah, they're close to home. So I go to them and I talk to Dr. Arena, and so I tell her the situation, and I'm like, so she's the one that saw me at my worst because she kept telling me to calm down, and I said, this is the problem. I can't just, this won't go away, and I'm not worked up, and it's that, so she saw the tremors and the high blood pressure and the whole deal and everything, and so they did their x-rays, they did their testing on me and stuff, and so, but I had told her, I'm about to go to this doctor I found in Florida, and she's like, oh, Dr. Hauser, and I'm like, you know him, and turns out she does know you personally, And so that was like, okay, that's my answered prayer right there, that, she was hopeful that they could get me all the way better, but she said, if not, 2 to 3 months of me adjusting you, we'll see where you're at and determine whether you have instability or not, and then, I'll send you to Dr. Hauser. And so here I am, because my upper cervical care with her had gotten me a lot better. I'd say if I was 10 or 20%, like when I came into her, it didn't happen overnight. It took 2 to 3 months, like she said, and I was a pretty complex case. So when I was like kicked in the head, and I twisted my neck, I forgot to tell you about that. That was one of the things that happened in May. So I was holding my neck, looking in the mirror at my back for probably too longer than I should have. And one of those episodes, that was the first one that actually ever happened in May of 2022. So I started to connect the dots of, oh my goodness, I know how this happened now. And when she x-rayed me and saw the position of my C1, C2, it was typical of a twisting injury and a lot of other things. I mean, she thinks, but that's why I also kind of wanted to do this, to make people aware that, like, because people would see me in the neck brace, because you had me in a brace for a while, and everyone's like, oh, were you in a car accident? Were you in a car accident? And I'm like, no. So it's crazy, like, things you do to your neck on a daily basis, and smaller things like getting bumped on the head, but if it's like so many things that add up over time that you do to your neck, I never would have thought you could get so disabled from things that you basically do every day. And so with me, that's like how it was. It was just a bunch of these little things, and it really jacked up my upper cervical.
So it's been a couple years. Like, I was treating you for a while, then you were better, right? And then did something happen, or? So
I was with Dr. Arena for 2 to 3 months when she said, I want you to go to Dr. Hauser. I think you have instability or whatever it is. He'll find it and he'll fix you. And so, like, we were all pretty confident. So I come down here, and we did the digital motion x-ray. We did the ultrasounds. Of course, my vagus nerve was almost half its size, and
you had kinking of your vertebral
arteries, which could have caused maybe some of those severe episodes where,
like, the blood supply was getting cut off, like when you turned.
Yeah, so I did. I had some kinking of the vertebral artery. Yeah, it's been a while since you first diagnosed me, because you ordered some scans, which I really appreciated, because no one would even give me an MRI. And so you ordered a brain MRI, a cervical flexion extension MRI, a CT venogram, and I was like so happy that someone's actually taking me serious, because I knew I had a structural problem. But the problem was that, I was going to go back home and try to get these scans ordered by my doctors. Nobody wanted to.
So that was the delay.
That was the delay. And my dad not wanting to, not wanting to send me back here and do this, because my dad's a skeptic. And
you did eventually get the venogram, right?
I did get all the scans.
Which showed the obstruction.
As I slowly got the scans, I would send them to you. So I sent you my brain scan, and my dad was, I think he was, like, I won't say happy that you ordered those scans, but I was trying to tell him. I said, Dad, you're so negative and so skeptical. And I said, this is the only doctor that's...
He's a believer now, though, right?
No, he never will be.
Even with the venogram?
He won't look at it. My dad is just like the most stubborn person. You've never had the wonderful privilege of speaking to him. He's the most stubborn person you'll ever meet. And the thing is, he knows in his heart that I'm better, but he won't ever admit it. And that's I love him. He's still my dad, and and I've got a little bit of his stubbornness, but if I didn't, then I wouldn't have been so like the last person you interviewed, I felt like her, like I'm like a mad scientist, and I'm like, if someone tells me like, no, this isn't the problem, and I know it is, I will research, and I will find out.
How many prolos did you end up with?
We're about to have my 7th one.
Okay, so where are you at in your journey? Like, how much? Because one of the things I was impressed with was your nails. Like just the art thing, and then
I started to be able to paint after. So let's explain that, because my story's kind of all over the place. But I was in such bad shape. you're right, I couldn't, just turning my head in these positions would trigger the attacks. And so even after working with Dr. Arena for the first couple months, it took me almost 3 months to be able to put eyeliner on. So, and then also I remember, so after being under her care for 1 month, I struggled to even paint a nail. And so, yeah, I would be like, I'd have to try to keep it up here, but my arms would go limp very easily. Yeah. So her adjustments would get me, like the tremor would go away when I would get adjusted. Yeah. The nausea is the first thing that went away because my digestion was really messed up. The time that I was super disabled, October through December 2022, my digestion was messed up too. Another vagus nerve thing. Now that got better after the very first Atlas adjustment. I woke up the next morning and I said, Mom, perfect. I'm not running to the bathroom. Like, so the adjustments did help me for sure. Yeah. So after 3 months of getting adjusted, I was better, but I would just come out of adjustment so easily and the symptoms would come back. And I still had to be, like the neck brace, that when I came down here to be diagnosed with you and you recommended the neck brace is the only reason I was able to work 6-hour shifts 5 days a week from the time that
you... at the golf course?
At the golf course, from the time you diagnosed me, but I hadn't started my treatments yet because I was trying to get those scans and everything. Right, the neck brace actually like helped me be able to work and do what I could. But yeah, it was still a struggle for me to do anything. I could not have done artwork like this. Yeah, my arms would, I couldn't sell people 6 beer.
So basically now you're able to do, like, this is very intricate. So you would have had to have been in like this position for, well, how long did those nails take?
5 hours. I did one hand one day and one the next.
That's what I mean. So you're able now to bend your head for 5 hours.
I am able to. I do have to, I am a little more conscious, obviously, now when I do artwork. So, but yes, you do have to have your head bent too. And even at work, I was worried about, like, because, like I said, I struggled to work last year. I was still getting adjusted, but I had to rely on that adjustment just to be able to function at all. And there was still 5 weeks I had to take off at the end of the year. And I come down here, and after my very first treatment, my arm strength improved. Like, I was able to, I did that painting for you.
You did, that's correct.
Yeah. And so I was like, you know, hey, like, I want to start off with something like a cartoon to see if I can paint again. I was like, I have to pace myself now, but I just wanted to see if I could do it, because this whole process for me has been, I have to take the tiniest baby steps or else I can go in reverse really bad. So anyway, I did feel better after my first treatment, and I noticed that I could, like, I was better at cleaning my room, because you know what caused me to miss those 5 weeks of work? All I did was do a load of laundry after work. Geez. Yeah, I couldn't even fold clothes if I worked a 6-hour shift. And at my job, I had to get people, like my mom was actually, recruited her to work because I couldn't even sell 6 beer to people. If I sold like 6 drinks to people, by the time I'd get the 6th drink, it would be like, and then I would just like be shaken and just lose, my arms would go limp, and it was so crazy that people would say that was anxiety. Because I tried my best, you know, and it was also a mental struggle because I'm going to work every day, I'm trying my best, and it seemed like it was getting me nowhere. So I talked my dad into letting me come here to start my treatments and everything. And so lo and behold, you know, after the first treatment, I started to be able to paint again. And I did have symptoms afterwards. Like the dizziness would come back, my head was real bobbly, my arms were limp again, so I'd get real upset and I'd cry. But then the next day, I could function again. Whereas before, that would have affected me for like weeks. Okay. And so I noticed that, like, that's been my process with prolotherapy. It's like a love-hate relationship, because there's obviously some side effects after the treatment, but then you get better, and the better is usually better than the better you were before. Yeah. So, it's a process, and it's definitely a process. But I have learned that this did not happen in my neck overnight. You know, it actually was almost 2 years worth of stuff that happened in my neck.
How are the episodes doing, like this seizure?
I haven't had one of those in a long time, and so...
Because I started mostly actively treating you starting
November.
This year.
It was last November,
It's been less than a year.
Mm-hmm. So Would you
say that everything's getting better? Like all the things that you came here are getting better? Is there anything not getting better?
The fatigue, the chronic fatigue that I was diagnosed with, I would say has improved the most. And that was one of my major diagnoses.
Like 70% better?
The fatigue is probably 80% better. Great. I mean, like before...
Are you able to work or not yet?
I'm working 9-hour shifts 5 days a week.
Oh, that's good.
And I struggled to work 6 hours before.
Good. That's going to make you feel good.
Yeah, and after the 4th treatment, I was able to, like, like it just felt like I finally got a little bit normal. I finally got some of my strength back because I don't have to have someone help me sell beer anymore. You know, I can lift about 9 or 10 pounds now, whereas before I started the prolotherapy, I could not even carry a 1 pound purse through the mall. I would go to the mall, and if I was lucky enough to be able to walk to circle the mall, like just walking it, I would have to put my keys in one pocket and my phone in the other, because carrying it was so weird. I mean, this is weird. Who does this happen to? You know, but like carrying any type of weight would trigger this tremor. And I do appreciate the UPMC neurologist, because see, my dad didn't want to believe you, so he wants to send me to a real doctor to to get a second opinion. He didn't really like his opinion either, but I will call it FND, if that's what makes you happy, Dad, because that's the doctor that diagnosed me with FND and chronic fatigue. And he didn't really know anything about prolotherapy, because I wanted to ask him, and he honestly really didn't know anything about prolotherapy, so he couldn't say whether it was going to help me or not. So I can't wait to tell him this, because I do appreciate that he actually wanted to see my tremor. He diagnosed it as a functional tremor, because he had me do this while we triggered the tremor, the episode, and he had me do this while it was happening. And so he determined it was a functional tremor, which is cool, but I'm glad he wanted to see it, because the Cleveland Clinic...
He didn't know the cause, though.
But he didn't know the cause of it.
Like there's a real tremor.
Right, there's a real... Like, I don't care what kind of tremor it is. Like, I want to know why is it...
Okay, I got you.
Yeah, like, I want to know why is it happening, because
Did you mention about cervical instability to the doctor?
Yeah, he didn't know about that either.
But he didn't, like, necessarily poo-poo it, right?
Yeah, right. He said, I'm not saying you don't have the cervical instability, but he didn't really know anything about it. He didn't
know if that could cause...
Right, exactly. I think that he didn't know, like, what all it can cause.
Have you been working on your curve to open up your jugular veins?
I have a little pillow that I lay on, and my curve was pretty good, but I mean, you did say keep working on it, you know, but I'm glad my curve was decent from the start.
You can dance or you can't dance yet?
I'm a little bit.
I know, but that's good. You're starting.
It's a start, you know, and I mean, like, honestly, I know I keep writing on the paper for my goal every time. Of course, I want to dance again, but
that's the goal.
But I mean, it's a goal for sure, but if it takes me a really long time to get there, you know, I just, like, want to make sure that I take, like, the babiest of baby steps to get there, because I mean, when you come from where I was before, I have to keep reminding myself, like, you know, when I get frustrated that I'm not, you know, Black or White comes on, or another Michael Jackson song, and I can't get up and just be nuts and dance to it like I used to. I have to remind myself, like, you thought you was gonna die before. Like, I mean, that's how bad it was, you know. So I'm so thankful for how far I've come. You know what I'm saying? And it's just like, and I was thinking the other day, you know, like, even if I don't dance again in this lifetime, I know that someday in the next life I'll be able to. And just, you know, I've really had to, that's something I struggled with at first, but I really appreciate too, you know, that that's one of the things you guys helped me with, is just I have to, and that's part of the treatment for FND is a CBT, you know, the brain retrain, and I do kind of want to do those too, you know what I'm saying? But I just knew there was a structural problem, and so I wanted to address the structural problem first. Were you getting clicking before you came here? Were you getting clicking? Yes, in your neck? And my clunking is less now.
I know that's good. So
I didn't have any pain, but
it would go out really easy.
You could hear, I could hear the clunk, and So for example, when I would do this, like to dry my hair, to wring my hair out, I would get clunk, like a big clunk when I would go to the side, like, and do that. And I wouldn't really get one of those episodes with the clunk or anything, which was weird. But now the clunking is less, you know. I just have maybe a little click and pop every now and then. And as far as my neck feeling more stable, that's what I was getting at too. Remember I said I couldn't, like, work more than 6-hour shifts, and that was with the neck brace. The neck brace got me through that pitiful 6-hour shift that I couldn't even sell pop to people. And now I'm working 9-hour shifts. I don't wear the brace. And I can't remember the last time I wore it was months ago. I think it was after my 4th treatment that I felt like I didn't need to wear the brace anymore. And so... Your mom's supportive, right? My mom, she's here. It was like pulling teeth to get her to come. Yes, Mom. But anyway, she's the most, her and my Aunt Ruth, which you've met Aunt Ruth, so they're the most supportive ones in the family. What do you guys do in the winter? But my mom's, you know how it is with mother. What do you do in the winter? The golf course is closed? The golf course is closed. So a short term, before we could put dancing on the back burner, and right now a short term goal of mine, since the golf course is closed in the winter, I would like to be able to work retail again, at least maybe a few days a week, so that I'm not completely broke, you know, throughout the winter time, because I used to work at Penny's full time, And since this happened to my neck, one of the things I struggled with was just walking, standing, and all that stuff. But now I notice when I'm at the mall talking to my friends I used to work with, they're like, Mary, like, you haven't had to sit down yet. It's been like, what, an hour? I said, yeah, I know. I was like, man. So, I mean, I think that,
You're doing great.
I think I actually may be able to work a 4 or 5 hour shift and go from there, in
You're
the
way
winter
more
time.
Optimistic now, right? When I first met you.
Oh, yeah. But I mean, like you said in one of your videos before, it's really hard to be optimistic whenever, you don't really know your future, because I'm a person that, like, I want to be optimistic, but I want to be real at the same time. Like, if this is how I'm going to be for the rest of my life, just tell me, like, so I know, like, I don't want to have a false hope. But you know what I'm saying? So, like, but it's so much easier to be optimistic when you see results, Gotcha. And so I'm going along, and I don't care what Dad says. He's just mad that I can't park a golf cart yet. I don't care, because I've seen what I was at before, and I've seen where I'm at now, and he didn't have to, he didn't live in my body when I struggled just to wash my face or brush my teeth. Or thank you.
I mean, like you could just tell you love your parents. You don't agree with everything, but you love them.
We don't get along all the time, that's for sure. But I know they mean well. But yeah, it's hard. I feel like I have gotten depressed because I feel like I have not had a lot of support through this, as far as I mean, like, I have a couple good friends. Gina was very helpful. My Aunt Ruth was very helpful, but she
ultimately does depend on you, though.
Yeah, I mean, it has.
We love to have family support us and this and that. And then here, I'll tell you one story about me that a lot of people don't know this, because many years ago, my father said to me, Ross, you go by the beat of a different drummer. My father loves me, gave me every opportunity. But imagine he gets a call. His son, his firstborn son, now is a doctor. And this is, as God is my witness, this happened. So I call him and I tell him I'm going to work with Dr. Hemwall, who was the world expert in prolotherapy. And he goes, Dr. Hemwall, who's he? And then I explain I'm going to be a prolotherapist. And my dad says, why can't you, for once in your life, do what other people do? Why don't you get a job at a hospital in the suburbs and just work in the hospital? Like, literally, that's what my father says. And it took several years before my dad came to the office. And you know the rest of the story. Of course, my dad, by the time I got a hold of my dad, he was already taking steroids for his neck pain. This is like 30 years ago. And then obviously I started doing prolotherapy on him, and my dad was in the same bad car accident when I was 14. He was driving, we both got a whiplash. And then so the prolotherapy kept me out of the surgeon's office, kept my dad out of the surgeon's office. He's 84 now.
But he didn't like it at first.
But I guess the point is, there's just times where you love your parents or you love your friends, but there are times where they do not understand. Like, my dad wouldn't know what I knew. I knew that if I work with Dr. Hemwall, he's going to teach me how to get rid of chronic pain. I didn't know ultimately it was going to lead to, like, the Hauser Neck Center and the vagus nerve and all that. But, it's similar to you. You've just got a great attitude, even though, you don't necessarily...
I've had a lot of negativity,
But you wouldn't know that from you, the way... you explain yourself, your countenance, your artsiness. Like, you embrace you, just like I embrace me. Like, I am who I am. People don't have to like me. Like, I don't dress like this so people look at me. I'm sure you dress a certain way that makes you happy.
That makes me, exactly.
And it makes me happy to see you. Like, what an outfit that I said, I got to get this on film.
And I really appreciate that, because, I mean, this is so great being here. It really is. Like, I don't even mind getting my neck injected, because it's just, like, so great to be around happy, positive people who don't care what other people think. And that's the thing, like, because I'm gonna get flack for something I'm wearing. People will fuss about, and I had to get to the point too where like, I don't care, like, this is me, you know what I'm saying? Like, I'm not like, yes, I'm a Christian, but I'm not a robot that I have to look the same as everybody else.
Just
you know what I'm saying? Yes, be yourself, and that's what brings the most happiness. And you know what I'm saying is just, so I mean, I do try to be positive, and like, sometimes they say a smile hides what the I don't even know what I'm saying. The smile hides the strongest tears or something like that. So, I mean, there's times that it is hard to be positive, you know, and I'm not always like this cheerful.
What would you like to see? I mean, besides getting back to dancing, is there anything else you'd like to see in your life? Like what is your deepest dream that you'd like to see?
Yeah, maybe I'll be a doctor now. I don't know. I mean, my dad says I should work here. He says, well, you just tell people about the vagus nerve all day long and this and that and prolotherapy. Well, you should work at Caring Medical. I said, maybe I will. I said,
you don't know. Go into the healing arts.
Or something.
You're very personable.
But thank you.
Do you have any questions for me? Like anything that we haven't discussed?
I don't know, put on the spot
like this. Because the prognosis is very good.
Yeah. Oh, we were going to discuss something else, but because, I did a little bit of your homework for you. Because the symptoms I'm still stuck with, I think I might have a clue where it's coming from.
Okay, go ahead.
You were the only doctor that, you shouldn't have been the first doctor. I've had it for 20 years. So you shouldn't have been the first doctor that diagnosed my TMJ.
Okay.
But I didn't realize TMJ can also cause neurological problems and these muscles to be fatigued. Because what I'm still struggling with now is, like, I could do so much more than I used to.
Yeah.
But I still do get the muscle fatigue sometimes and a little bit of tremor, not much, but I still have a limit of what I can do. I definitely can't go jump around like a nut and dance to Michael Jackson right now.
Okay.
But anyway, so yeah, like I was researching I was researching the TMJ, and you know, I think some of my problems are coming from that. But I'm a little scared to get needles in my face because my face is so sensitive that those attacks get triggered by the slightest little pain or stimulation to my face. So that's basically what I'm still stuck with is, hey, if I don't touch my face, I'm great, you know?
Okay.
But I think some of the headaches I still have and stuff might be attributed to the TMJ.
There's a, I don't know if we've ever talked about the trigeminal cervical nucleus, but you know, all the sensation of the face is the trigeminal nerve. And then
the trigeminal cardiac reflex, I'm a little concerned about.
Okay, yeah.
My brother has syncope. My brother has vasovagal syncope. So I try to explain
saying that the upper cervical region and the spinal cord interacts with the trigeminal nerve around C1, C2. Yeah. So that's the connection. So anybody who has like something related to the trigeminal nerve, like you talk or you laugh or you touch your face,
when I chew,
or you chew and then you get a symptom that normally means you have an upper cervical problem. You have an upper cervical problem.
Well, this is what I would explain. Like that would very much explain why I've gotten as much better as I have, because like you were saying in that one video that I think was about the syncope, and you were saying that, you know, if you have issues with a trigeminal nerve and you have issues with a vagus nerve, well, it's not going to make it better. It's going to make it a lot worse. So now we've like healed the vagus nerve aspect of it. So, you know, I don't get like, you know, I don't get near as bad of an episode as I used to when my face is stimulated, but it's still scary nonetheless because it's almost like an extreme panic attack. Like people thought for the longest time, and my mom's gonna just like kill me that I'm saying this in the video because if she hears about pimples one more time, but yeah, she used to tell me to get me to quit picking my face, that pimples were gonna kill me because of this death triangle or what. You probably heard that before being a doctor. But I mean, you probably never actually knew anybody that's died from a pimple because we go to town squeezing them. I mean, my whole family does. But so she used to tell me that just to get me to quit picking my face. But now this was years ago. And so, but one time after I had squeezed a pimple here and I forgot about it. I'm driving down the road, you know, or whatever. It was a few minutes later. I get a stabbing pain and I literally almost pass out driving. Okay. I get the face spasm, I get a headache, and I got really dizzy. And I'm like, what was that? And so now I'm learning, and that would happen almost every time after that. And it started not just to be the triangle pimples, like it would be, guess what? Oh, the ones over the TMJ, or it would be down here, or so now I'm learning, again, putting pieces of the puzzle together, like, hey, oh my goodness, my trigeminal nerve is jacked up and it's causing this crazy sympathetic storm or whatever kind of reaction that isn't a panic attack that I can't control because the other day it just happened again. And obviously, like, I know I'm not going to die from a pimple. It was right here. And, you know, just like the slightest amount of pain from that, like, I did have one of those attacks, and it's scary because you feel like you're having a heart attack when it happens. And my eyes get this big, my pupils, and sometimes it's just one of them. Like where this pupil is, I'm a weird one. I know.
Yeah, you should take a picture of that.
Well, my mom's like, I don't want to.
Well, I think video is important. Like I had a patient.
So you can see what's going on. Yeah, because good doctors want to see what's going on instead of shake their head.
Well, like Izzy, a patient came in, they got a clicking sound, a drum sound. and then they open their mouth and their palate, the palate is going up and down by itself, because that's all you're saying. Is it's very scary, like your body's vibrating, your body's twitching, like it's not under your control.
Yeah,
that's
right.
how you know it's a real thing.
Right.
It's a real,
you can't
real
just
thing.
think it away
you
with
can't
happy
just
thoughts.
Assume, you can't just assume everything that you can't explain is because I'm under a lot of stress.
Right.
Like, you know, when you're at the golf course,
under
or you're
stress
at,
now.
Everybody's always under stress.
I'm under stress now because I'm on camera and I'm not like shaking.
Right,
I mean, if it was anxiety, I'd be having the tremors right now. You know what I'm saying?
Yeah,
like
that's
it's just
exactly right.
Yeah. So I mean, like I
That's
just
exactly
really appreciate everything
Mary,
you guys
thank
do
you so
down
much
here.
for talking and everything, and I'm
Thank
sure the
you.
video is going to help a lot of people. And
Thank you.
We just thank you so much and look forward to getting you all the way better.
Thanks. I hope so.
Thank you.